All right, so welcome to the first podcast that you and I have pretty well ever done. Should be a bit of fun. My name is Duncan White. I am a principal physio at Transcend Health, and I'm joined with...
My name is Ollie Morsley. I'm the other physio at Transcend Health.
Yeah, the slightly better looking one, definitely younger. And I guess the reason that we decided to start doing some recording and getting some information out there is there's a lot of information for physios in terms of podcasts and things like that, but we've really found some frustration with some of our clients when there's nothing really talking to them about their experience in trying to get through pain, start exercising or getting better. So I think our intention for this is really to start providing little snippets of information. Usually, what do you think? About 10 minutes worth?
Yeah, I think 5 to 10 minutes. Something short. It's not too complicated. Gets the point across and empowers you guys to have a bit more knowledge around what's going on. Maybe if you're going through an injury or something like that, give you guys a few more tools or ideas to think about as you go through that process.
Yeah, 100%. So I guess to kick it off, let's talk a little bit about pain. All right, so as you may or may not be aware, pain gets a lot of attention lately in the media, and there's a lot of different experiences that I know I've faced as a physio with some of my patients, and you've also faced, I'm assuming, where trying to explain the pain phenomenon and what's happening is really, really difficult and difficult to understand. So do you want to provide some insight from the physio perspective for the clients on what is kind of happening when we feel pain or what might be happening?
Yeah, well, again, you could talk about this for a lot longer than 7 to 15 minutes of people who devote their lives to talking about this kind of stuff. But it's about honing in on what's kind of relevant to you guys and what's relevant to take away. And I think we could do that with a couple of key pieces of information. Starting, I guess, with the first one, which is that damage doesn't equal pain.
Necessarily.
Not necessarily.
Yeah.
Not necessarily. So there are very clear examples where people can have a lot of damage and be in a lot of pain. Don't get me wrong, it's very clearly a true scenario. There are also cases where we cannot have physical damage but still have pain. Think of some examples.
Yeah, so I'll put 2 examples and Ollie will be able to explain these a little bit. So one would be I've just rolled my ankle stepping off the gutter and it's really swollen and red. And the second example is that I've been suffering with lower back pain running into my left leg for the last sort of 5 years, and I don't really know how it started.
Yep, very clear examples there.
So can you explain maybe a little bit about what's happening in the pain in the first instance, which was the ankle, and then we'll move into probably the more complicated one, which is the back.
Okay, so obviously in the ankle one, if you rolled your ankle, there's going to be some sort of trauma that's involved. The ankle's been moved in a way that it's not normally wanting to do so. Some of the ligaments might have gone through a little bit of trauma there. There's a healing process that's been elicited, and some swelling might ensue. That damage, if you want to consider that damage, may be associated with pain. There could definitely be some pain there. I know when I've rolled my ankle, it's been quite sore and swollen, so that's happened to me in the past. So I think that link is quite clear. When we get into the low back that's been going on for years, months even, we're past that window of what we call tissue healing time. So if there was even an instance that was associated with trauma or damage in the back, beyond about 6 to 12 weeks, that's past now. And unless things are being re-damaged and so on, if you want to use that term, we can pretty much safely say that all of the tissue in there is pretty well good and functional and happy and healthy.
Yeah. Can I just ask you to expand on that a little bit, very briefly, in that it might look like there's some damage on a scan. For example, there might be a disc bulge or some old scar tissue or degenerative change, which gets used a lot now. Degenerative change, for the listeners, just means changes to the joints and other tissue surrounding the joints that's age related, kind of like getting wrinkles on your skin. But let's say that that's occurred, so you've got these changes. Are they a cause of pain?
So research has shown that they are not necessarily a cause of pain. And we know that they can not be associated with symptoms at all. So you and I have both seen people who come in with pain, and they might come in with a scan as well of the painful area. And the scan may go one of two ways, I suppose. One that is completely clear, and they still have pain in that area. And I guess that ties into the scenario of, well, nothing appears to be damaged here, but I have pain. Well, what's that all about? That's something we might delve into a little bit later. But what we're specifically asking is, hey, this person comes in with, let's say, a sore back. They come in with a back scan, and the scan shows degenerative change or a disc bulge or so on. And research has in recent years very much found that symptoms, what you're feeling and experiencing, doesn't always line up with what the scan shows. All right. So it is an important piece of information, and that's usually what we'll say to people. It is an important piece of information, but it's important to take in broader picture, right? Because at the end of the day, what that scan says and what it displays is not really relevant to you and your life, and what you're experiencing in your life, what you're able to do and what you're not able to do, is more important to you.
The analogy that we both use and that I quite like is the scans and the damage, if we're going to call it that and label it that, which may not be overly accurate, but we're going to label it as a starting point for the discussion, is one piece of the jigsaw puzzle.
Yeah.
And so we can hone in on that piece and run away with what it may or may not mean, but there's a whole nother 100 pieces to this puzzle that creates the picture that is the person. And so I guess to finish off, let's just add in a couple of other things that can influence the pain experience in this person with back pain.
Yeah, okay. So I guess a common one that's thrown around is stress. You know, if you're going through a particular sort of back injury, back pain, and there's a lot of stresses going on in your life, if you're going through a breakup or a lot of financial stress, job's going crazy, something like that, it's going to make the pain worse, likely. When we're stressed out, we've got a lot going on, pains get exaggerated a little bit.
Our sensitivity how sensitive we are to them goes up.
Yeah, for sure. And I guess that there are other ones that feed in. Do you want to mention a couple to sort of
so some of them are beliefs about what's going on or what we've been told from other health professionals.
Definitely. I think that's a big one.
It's a huge one. And also from your life experience. So you might have had, your mother had a back problem and was crippled with back pain, and then so automatically you've seen this very negative outcome and you think that you're going to have it happen, which again elevates your sensitivity to what you're feeling, which basically means that you're not able to deal with as much pain in that situation. That doesn't mean you have a bad pain threshold, which we'll talk about another day, but it will decrease your sensitivity. That's one. Other factors are things like weight, which is actually really interesting. It's not always the mechanical load of being overweight that's a problem. It's one part of the puzzle as well. But what happens is when we have more fatty tissues, we release what's called, and I'm going to use a scientific word, adipose cytokines. Just think of them as
chemicals in the body.
Chemicals in the body, thank you. That increase general inflammation, and if there's somewhere where they may be attracted to, they will tend to accumulate more there and cause further inflammatory pain. Another risk factor is if you did do something like roll your ankle and you didn't get it managed very well and you were in excruciating acute pain that wasn't controlled, then that's a high risk factor for longer term persistent pain as well.
Yeah. I think beliefs around pain really
It's
drive,
huge. Yeah.
how your pain experience. They really drive it. So you could think very positively about your injury, and if you know and you feel convinced about that your injury is going to get better and that it's not that bad, and you'll get over it, and you can still do stuff, and you do still do what you do in your life, then you will recover quickly.
Yeah.
It's pretty well documented. And if you go the other way and you say, oh well, rolled my ankle, I can't do anything, I'm incapacitated, I certainly can't stand up and walk around, I can't hang the washing out, can't climb up the stairs, then you won't. And that sort of really feeds in very deeply into both the intensity of the pain, what you're able to do while you have the pain, and also the prognosis or the length of time that you will be in pain.
Yeah, absolutely. Well, I think that's probably pretty good for today. It gives you guys a starting point. If you do have any questions, feel free to hit us up on Instagram. We are at Transcend Health AU. We'd love to hear from you. Ciao for now.